all pregnant ladies who are in like 5th month of their pregnancy who need level 2 scan. So today we will talk what is level 2 scan or anomaly scan. So for level 2 scan, we should have a good machine like we have here, Ultrasound S10, on which the machine should have a good resolution so that we can see all parts of the fetus in detail. So now I am explaining what all we see in level 2 scan. This is baby's head. So in this, this is skull bones and the inner side of the brain. So few patients must be wondering what is 3D 4D scan. So if we are able to see a good window, good liker in front of the fetal face. So this is face profile view in 2D image. Then we can do 3D reconstruction, or we can see this baby moving in 4D also. So these are 3D images of the fetal face. So this we can do for every part also, but majority we are doing for fetal face. And if there is some defect somewhere in the fetus, then also we do 3D 4D reconstruction of those images. So these are the baby is thinking something, putting his hand over the face. So these kind of beautiful images also we see in 3D 4D scans. So now I will explain what all we see in level 2 scan. So level 2 scan basically means we have to check all parts of the fetus, like fetal head, backbone, spine, then chest, abdomen, limbs, hands, feet. So all parts in detail we see. Whatever part we see first, then we keep on taking pictures. Now here is one patient which I have done today. The first, when I put the probe, I saw the backbone of the baby. So in the backbone, I will see this is reed the haddi, and over which there is skin. So it means there is no defect in the backbone. So next, I see this is the cervix, like the birth canal. It is long and the internal os is closed. And second, I see placenta. So from where the baby is connected with the mother. So we see position of the placenta. Then I measure bones, femur length and humerus length, like the thigh bone and the arm bone. In the next slide, I am able to see the kidneys. So this is backbone, this is the kidney, right kidney, left kidney. So then I have taken the abdominal circumference, this is stomach. Then we see spine in coronal section. This is the tip of the bone, 2 iliac bones. Then the 2 renal arteries. See this beautiful image of foot, baby's foot. And in the next image, I have taken both the lower limbs. This is the foot with the leg, and this is another foot. And then stomach I have already shown. Then there are 2 umbilical arteries. So in the cord there are 3 vessels. There should be 2 umbilical arteries and 1 umbilical vein. And again the baby's feet. Then there is tip of the fingers, 5 tip of the fingers here, 5 here. So both the hands I have seen. Now we can see 2 hands together. So it means there are 2 arms. Then this is again spine photo. And then this is heart photo. In our heart there are 4 chambers. So we see 4 chamber heart, and then 3 vessel view. There is RVOT, LVOT and superior vena cava. So then on color Doppler also we see both the views again. Then again RVOT dividing into 2 and LVOT in the center. So in the next picture we see two orbits, and we can see even lens in the orbits. And here we are able to see maxilla. Then we see two nostrils, upper lip, chin. This is side of the face. Inside of the face we see nasal bone. This is very important thing to see, like if the nasal bone is not seen or it is small, it means there can be possibility of any genetic problem like trisomy 21. Then again hands, I am able to see, this is again fetal face. So then we measure the what is the heart rate. Then now the baby has moved to other side, so the spine has gone to the other side, back of the mother. Then hand in front of the face. So this is again I am able to see 4 fingers in the image, like actually there are 5. Then there are again feet I am seeing. So here in the fetal head we see like many things. So this blank space is CSP, this is ventricle, we measure size of ventricle, is the pressure of CSF is more, then the ventricle width will be more. Then we see very important structure here, cerebellum, the fluid behind the cerebellum, then this thickness of nuchal fold. So there are many things, we see everything in detail. So level 2 scan means we see each and every part of the fetus, we try to see. So here it is very important to understand, level 2 scan is basically to see the structural malformations. So when we say like level 2 scan is okay, normal, it means the majority of the structural are well formed in the baby. There is no malformation. But all kind of genetic problems cannot be visualized on ultrasound. So 75 to 80% problems we detect on scan. 100% scan is not 100%. But again, it is very important to get it done, because there are many things which we can rectify, which we can correct. And sometimes like if it is a lethal malformation, baby is having like defect in the backbone, or the brain is not well formed, or heart is abnormal. So there are many things which are lethal abnormalities, so in which the patient can go for like termination of pregnancy, or few things are correctable also. So it is important to get it done, because the things which we can correct or modify, we should be able to do them well in time. And so we say best of luck to all the pregnant ladies, and we try to give our best while we are doing the level 2 scan. Thank you so much.